WQCT Q96.5.
And our final segment today on the Medical Hour, brought to you by the Medical Specialty Clinics of the Bryan Hospital and the Community Health Professionals, is with Chad Tinkle, the President and CEO from Community Hospitals and Wellness Centers. And Chad, welcome into the program today.
Jim, thanks for having me. I appreciate it.
This has got to be quite a start, fella. I mean, you know, this is year number one for you, and most people don't get to come in and have to deal with a pandemic in their first year.
Yeah, it has been an interesting first 12 months for me, and this is just adding to it, but I'm very grateful for the staff that we have here. They've been doing a tremendous job getting us ready for this, so I'm very fortunate with who I get to work with.
Yeah, you do have a good crew over there. There's no doubt about that. Give us an update, because I think everybody, as I've worked my way through Jim Watkins, and then I also talked to Jennifer Weber here in the last segment, everybody says, you know, we know that the number, the head count's kind of low, but the people that have done any testing whatsoever sits across the street, and Chad Tinkle will give you a little better feel for that. What's the hospital seeing nowadays with potential cases when the media says there are 0 in Williams County?
Yeah, sure. So what the hospital is seeing right now is decreased volumes. So we've cut back on our elective surgeries. We've cut back on our appointments. We're trying to establish more telehealth options. So we're seeing the amount of patients coming to the hospital a great decrease. Bryan ER is down 30%. Montpelier ER is down 50%. And this is allowing us to have more time to prepare for that surge that's going to be coming in the next 2 to 4 weeks, based on some modeling numbers done by Ohio State, Ohio Department of Health, and Ohio Hospital Association. So we've been working diligently getting ready for that point. Some of the areas that we've done is we've dedicated a COVID-19 unit that will allow us to go up to potentially 26 beds in that dedicated unit. And we've converted some, as I mentioned earlier, we stopped doing elective surgeries, so we've converted some of the ambulatory surgery area to house some of those overflow patients that we that are projected to be coming here in the next, as I said, 2 to 4 weeks.
Wow. So basically the projections that everybody's hearing right now is that we may have similar problems that maybe some of the other cities in the United States are having before the month's over, before April's over.
Correct. Based on that modeling, they're projecting that, you know, what our average census is between Bryan Hospital and Montpelier Hospital combined, that we're going to see potentially 4 to 5 times what our normal averages are.
Wow. So how are we doing? I guess the obvious question, how are we doing for test kits? How are we doing for all the personal protection gear that our staff's going to need? And the ventilator question, are we prepared? Are we heading in the right direction?
The answer to all of that is yes, we're preparing and trying to get to those modeling numbers so that we are ready. From a test standpoint, we've done over 40 tests so far. We've had over 40 results come back. They've all been negative, so not positive for COVID-19. We have probably in the area of around 150 tests available. So the test kits availability are limited, like it has been mentioned, and that's why the state of Ohio is asking only for certain tests to be done, certain criteria before a test is done. But there's also an issue with turnaround time, and we've been looking for solutions on that. One that we came up with late last week was the University of Toledo. They're having a much quicker turnaround for us. So we're getting results back between 24 and 36 hours now, so that is helping.
Yeah, what was the turnaround time before, Chad?
Turnaround time before was with the private labs around 7 to 10 days. If they met all their criteria, meaning they were an inpatient and we were able to use the Ohio Department of Health, that was 2 to 3 days.
So when you tested and have tested the roughly 50 people or so that you've tested right now, you're not holding those people at the hospital for that 7 to 10 day turnaround, or you're sending them home in quarantine at that time?
I would say about 75% of those tests are for individuals that are not inpatients. Mm-hmm. So you have about 25% of those that are inpatients. individuals that show symptoms of the COVID virus, but as Dr. Weber mentioned, there's a lot of overlap there to symptoms related to flu, pneumonia, and that. So we've taken care of some pretty sick patients that they might be suspect COVID, but then found out that they were not.
Now, some of these tests, from what I'm seeing on the national media, there are 2 or 3 or 4 or 5 or 6 now different tests out there. Some that are more accurate than others, some that have been said to be just totally inaccurate at all. How comfortable do you feel with the testing process for our patients here in Williams County?
Sure, yeah. We're only using labs that are FDA approved. So, of course, the Ohio Department of Health is approved. We were utilizing LabCorp as our private lab before. That was approved by the FDA, and the University of Toledo has been approved by the FDA. So there's a very high comfort level with that.
Yeah, that is good to know at least. How are we doing for the other supplies, the personal protection supplies now?
Sure, yeah. First, let me thank the community. There's been many industry in the community that have donated some of their N95 masks, their goggles, their face shields. From the PPE standpoint, we're putting together some surge numbers right now to get a burn rate for when we do hit those high volumes in 2 to 4 weeks. We're starting to go from adequate supply to getting to that critical level if when those surge levels hit. So if there's any other, we're actually reaching out to individuals now on certain things. One of the main things that you asked about earlier that we're reaching out to community members right now are our vent, our anesthesia machines. We do know we do need more of those, so we're trying to coordinate those efforts right now.
How many ventilators do we have in the Williams County system?
Sure. We have about 16 ventilators right now. We have BiPAPs that can be used as a last resort. We have about 10 of those. So we're looking to try to get, so if you put those together, it's around 26. We're looking hopeful to get close to double those volumes. So we're looking for 20 or so additional vents, anesthesia machines.
Interesting. Have you seen any of the nightmares that have been discussed on national TV, where one hospital is bidding against another hospital for some sort of goods? So all of a sudden now, what used to cost you $1,000 is $10?
Yeah, there's definitely been an inflation in some of the PPE supplies. I can give you a good example. N95s, typical, are 55 cents. They're going to be around $3 right now to go out and buy an N95.
Wow.
So, yeah, we have seen that. But in coordination and collaboration with regional hospitals, we've been working with the hospitals, roughly 34 hospitals in 18 counties, which is referred to as Region 1 in the state. We've had coordinated meetings with them, and we've actually come up with a plan with those 34 hospitals on how we could coordinate efforts to deal with this crisis.
That's good to hear because, unfortunately, or fortunately, either way you want to look at this whole thing, obviously if you have a dense population like a New York or in Los Angeles, and they have the problems that they are running through right now, that's obviously where you need to send most of the gear, but that leaves the guys on the other end of that spectrum like us kind of hanging for gear because we're the small guys and we don't have the big voice.
Yeah, I think, as I mentioned earlier, the staff here has done an absolutely fabulous job of preparing. I think that we were probably about as well prepared as any rural hospital in the area, but realize that we cannot do this alone, and also realize that we may need to be there to take care of our fellow community counties that are around us.
Yeah, no doubt about that. It could be a very frightening thing, but I don't like to. I am not a fearmonger, okay? And I guess the thing I ask you right now is maybe why we are behind so many other areas. I mean, we have not had the cases and the overwhelming numbers of people heading to the emergency room that other cities and areas have had. Any thoughts on why maybe we're lagging behind?
A couple there. First, as a state as a whole, very grateful for how proactive Governor DeWine has been. I think that's helped the state out as a whole. Then when you narrow down to the Northwest region, and specifically Williams County, we are a rural area, so our population isn't quite as dense. And I do believe what Rachel was mentioning earlier, and Dr. Weber was mentioning as well, we've been pretty selective in our test, so we're only testing those that are showing the symptoms and have that are potentially inpatients or other circumstances. So we're limiting the amount of tests we're doing. So I think there could be potentially some asymptomatic patients in our area, as Rachel was stating. So I think that we just need to be ready.
Yeah, we do. Chad Tinkle, the president and CEO from Community Hospitals and Wellness Centers, on the line with us right now. Are we ready, Chad? Because you said earlier on, I think 50 or so cases that we've tested right now. That number could go to 250, 300 in a couple of weeks. If all of a sudden you see 250, 300 people showing up at your door that are honestly ill, are we ready for something like that, or will we be ready in 2 weeks?
Well, the modeling shows that we're going to hit our peak just over 100 inpatients. Okay. So I don't think we're going to see the numbers of 200, 300. But yes, we will be ready for the modeling numbers that have come out so far.
Fantastic. Well, that's good to know. From the very beginning, I'm sure this was something that set all the bells and whistles off at the very beginning, and it does seem like our group, whether it's the health department or the doctors or the hospital around our area, have done a pretty good job of setting us in the right path.
Yeah, we are extremely lucky, and I'm grateful for the collaboration that we have between the health department, the physician group, and the hospital. The other healthcare organizations within the community, we do a very good job of working with each other.
Yeah, no doubt about that. Chad Tinkle, any last thoughts before I let you get back to, I'm sure, what is a very busy day on a Wednesday at the hospital?
Jim, I appreciate you helping us bring awareness to the COVID crisis and pandemic to our community, so thank you for hosting us today.
No problem. Thank you for being here, and as I've told the other guests, anytime you need us, Chad, whether it's us or our sister station, B-Rock, we're yours, man. Between this whole thing, our goal is the same as yours, to keep as many people safe and healthy as we possibly can.
Wonderful. Have a great day, Jim.
You too. Chad Tinkle, the president CEO of CHWC, and that will wrap up our medical program today on the Q 96.5 FM.